Imagine waking up every morning with steady energy, no sugar crashes, no fear of complications, and complete control over your health. For millions struggling with diabetes or prediabetes, this feels impossible. Yet the truth is, the body has an extraordinary ability to reset. The book The Diabetes Reset reveals practical, science-backed strategies to reverse insulin resistance, control blood sugar naturally, and reclaim energy without relying only on medication. This is not about quick fixes. It is about rewiring habits, nutrition, and lifestyle to transform health at its core. Understanding insulin resistance. Blood sugar spikes happen when cells stop responding to insulin. This resistance forces the pancreas to produce more insulin, leading to fatigue, weight gain, and eventually diabetes. Understanding this mechanism is the first step to reversing it. Example: a middle-aged professional constantly feels tired, even after meals. Tests show elevated fasting glucose. By learning that his body is resistant, not lacking insulin, he shifts from fear to strategy. Research from Harvard confirms that insulin sensitivity improves dramatically with diet, exercise, and weight management even in late stages. Food as medicine. The food you eat can either fight insulin resistance or fuel it. Choosing whole, unprocessed foods rich in fiber slows down glucose absorption, giving the pancreas relief. Lean proteins and healthy fats stabilize energy, while refined carbohydrates create spikes and crashes. Example: replacing a breakfast pastry with eggs, vegetables, and avocado keeps blood sugar steady for hours. A study in the American Journal of Clinical Nutrition shows that high-fiber diets reduce type 2 diabetes risk by up to 30%. Timing matters. When you eat is just as important as what you eat. Late-night meals keep blood sugar elevated during rest, blocking recovery. Front-loading meals earlier in the day gives the body time to process glucose efficiently. Example: a family that shifts dinner from 9 p.m. to 6:30 p.m. notices better sleep and lower morning glucose. Research from the University of Alabama demonstrates that early time-restricted eating significantly improves insulin sensitivity and reduces appetite. Movement as medicine. Exercise acts like a sponge for excess glucose. Even short bursts of activity after meals help muscles pull sugar from the bloodstream. Strength training builds long-term sensitivity, while walking lowers post-meal spikes. Example: a woman with prediabetes begins walking for 15 minutes after lunch and dinner. Within weeks, her glucose monitor shows lower peaks. Clinical trials prove that moderate exercise can reduce progression from prediabetes to diabetes by nearly 60%. The power of weight loss. Even modest weight loss dramatically reduces diabetes risk. Shedding just 5 to 10% of body weight improves insulin sensitivity, lowers blood sugar, and reduces strain on the pancreas. Example: an overweight father loses 15 pounds through better eating and walking, and his HbA1c levels return to normal range. Research from the Diabetes Prevention Program found that lifestyle changes were twice as effective as medication in preventing diabetes onset. The role of sleep. Lack of sleep disrupts hormones, raises stress levels, and increases insulin resistance. Quality rest resets the body and supports stable glucose. Example: an entrepreneur sleeping 5 hours per night notices cravings for sugar during the day. By increasing sleep to 7.5 hours, energy stabilizes. A study from the University of Chicago revealed that sleep deprivation reduces insulin sensitivity by over 30%. Stress and blood sugar. Chronic stress raises cortisol, which signals the liver to release glucose. This hidden factor keeps blood sugar high even with a healthy diet. Managing stress is crucial for resetting. Example: a teacher practicing daily deep breathing lowers her stress and notices smoother glucose levels. Research shows mindfulness and meditation significantly lower HbA1c in patients with type 2 diabetes. Reversing prediabetes. Prediabetes is not permanent. With consistent lifestyle adjustments, the body can reset and return to normal glucose levels. The earlier the intervention, the higher the success. Example: a young adult diagnosed with pre-diabetes shifts eating patterns, adds daily walks, and within a year no longer fits the criteria. Studies confirm that over 50% of pre-diabetes cases can be reversed with sustained lifestyle change. Building sustainable habits. Quick fixes fail, but consistent habits create lasting health. Tracking food intake, planning balanced meals, and choosing small daily changes lead to big results over time. Example: a mother replaces sugary drinks with water and encourages her children to do the same. 6 months later, the family collectively lowers their risk. Behavioral science shows that habit stacking, where new routines attach to existing ones, greatly increases long-term success. Medication and lifestyle together. Medication helps manage blood sugar, but lifestyle resets amplify results. By combining the two, patients often reduce dosages and gain better long-term control. Example: a man on metformin adds daily strength training and clean eating, later requiring less medication under doctor guidance. Research confirms that lifestyle changes can improve outcomes beyond medication alone. The future of diabetes care. Technology now empowers individuals to track glucose continuously. These tools show instant responses to food, sleep, and exercise, motivating smarter choices. The future is not only in treatment, but in prevention through awareness. Example: a young woman using a continuous glucose monitor sees how soda spikes her sugar, leading her to cut it out completely. Studies show that real-time glucose feedback creates stronger adherence than advice alone. Closing challenge. The body is designed to heal. Diabetes does not have to define your life. Begin with one reset. Replace one sugary snack with a high-fiber meal, or take a 10-minute walk after dinner. The power of transformation lies in daily choices. Think of your body as a system ready to reset, and every step you take rewires it toward health. The challenge is simple. This week, choose one reset habit, commit to it, and experience how small steps lead to a healthier future. Your journey to better health starts here. Subscribe now for fitness tips and natural diabetes reversal guides. Take care, stay healthy, and see you in the next video.